But we begin with the Republican Party's failed effort to stop America from getting a jobs bill. While the country is mired in double-digit unemployment, Republicans voted today to filibuster the jobs bill. It was only able to advance when 5 Senate Republicans bucked their own party and voted with Democrats to allow the bill to move toward a final vote. Every other Republican who voted today, aside from these 5, plus conservative Democratic Senator Ben Nelson, voted to filibuster. To be clear, they didn't just vote no on a jobs bill. They voted to not even allow it to pass if it got a majority vote. They filibustered it because they filibuster everything. This is the Tarantino in action. It kills bills. It's the Republican effort from the minority to filibuster absolutely everything. So everything of any consequence in the Senate takes not a majority, but a supermajority, 60 votes to pass. This has never been done before. But it's being done now, even on a jobs bill. The Tarantino has become such a huge problem in Washington that even outgoing Democratic Senator Evan Bayh, quite literally the least partisan person in the Senate, he's the most conservative Democrat in the Senate. Even Evan Bayh has made a huge splash on his post-retirement announcement tour by drawing attention to the Tarantino. Senator Bayh wrote an editorial in the New York Times over the weekend in which he said this: "Historically, the filibuster was employed to ensure that momentous issues received a full and fair hearing. Instead, it has come to serve the exact opposite purpose, to prevent the Senate from even conducting routine business. The minority has a right to voice legitimate concerns, but it must not employ this tactic to prevent progress on everything at a critical juncture for our country. We need to reduce the power of the minority to frustrate progress. The number of votes needed to overcome a filibuster should be reduced from 55 to 55 from 60. Senator Bayh's retirement tour even took him to the set of The View today, where he again invoked the Tarantino.
The filibuster, it's just got us stuck in the Senate. It's frustrating progress. Back in my father's day, they reformed it. I think we need to reform it again.
Senator Bayh has pledged to use his remaining days in office to not just talk about the Tarantino, but to do something about it. But even if Democrats launched a full frontal assault on the filibuster right now, starting tonight, they, in all likelihood, would not be able to get it done in time to save the one thing that is critical to this country, both policy-wise and critical to Democrats' collective political future, and that is health reform, the prospects of which, like everything else, are threatened by the Tarantino. Democrats cannot wait until the filibuster is dead to move forward on health reform. They have to move health reform in a way that just gets around the problem. And that's what the White House started to do today. President Obama introducing his proposal to move health reform forward. It consists of minor tweaks to the Senate version of the bill that are specifically designed to allow Democrats to bypass the Republican filibuster and pass health reform with a simple majority vote in the Senate. Now, here's the funny thing about President Obama's proposal. On the front page at Politico.com today was this screaming headline, "The Obama Plan." And it had this picture of a giant stack of paper next to the president. I have no idea what is in that stack of paper, but I can tell you tonight, it is not the health reform proposal that President Obama released today, unless it's like 1,000 copies of that proposal. Because if you want to see what President Obama introduced today, it's this. It's 11 pages. That's it. 11 pages that consist of minor tweaks of what's already been passed by the Senate. It's not starting over, as Politico.com might have you believe. It's finishing up. And this is important in terms of understanding where we are in this process. This is what already passed the House. This guy. This one passed the House, right? 2,016 pages. It passed way back in November. This is what's already passed the Senate, all 2,409 pages. This passed on Christmas Eve. These have already passed their respective chambers of Congress. House, Senate. And the way it works, as we all know from Schoolhouse Rock, is that if 2 different versions pass 2 different houses, they have to be merged, and then that merged version has to get passed again. But because of the Tarantino, because Republicans filibuster everything, because Republicans are filibustering health reform, Democrats have to come up with something that reconciles these 2 bills that can avoid that Republican filibuster. And this is what does that. This is the view of the White House. This is what the president thinks could be done. This is what remains to be done, according to the White House. It's 11 pages. This is not a new proposal. It doesn't replace everything that's been done. So feel free to ignore Politico.com on this or any other issue. Their front page all day has been visually misinforming you on what they call the Obama plan. Nothing that looks like that can also look like this unless it's printed really, really big. Republicans have thought that they killed health reform, but they didn't. It's passed the House, it's passed the Senate, and now it's very much alive. There are only 11 pages to go. We're almost done here. Joining us now is Ezra Klein, staff writer at The Washington Post. Ezra, thanks very much for being here tonight. Appreciate it.
Good evening, Rachel.
First of all, am I right to think that we are pretty close in the grand scheme of things to getting health reform done here? If you can spell out the fixes needed to get things done through reconciliation in 11 pages, it sort of seems like we're getting close.
We are very, very, very close. Closer not only than we've ever been, but literally, they could do it without those 11 pages. The House could, if it wanted. It doesn't want to, but if it wanted, it could pass a Senate bill in 24 hours and it would be on the president's desk. So it is astonishing how near they are. And to let it go now would be sort of a tragedy that would be unparalleled in any recent legislative effort that I can think of in American politics.
When I read through this today, and it's readable because it's only 11 pages, in terms of the substantive policy changes here, what are the main takeaways here? Obviously, people are very focused on the fact that the public option isn't in there. We had talked with Matt Iglesias on this show on Friday night. He had said not to expect it to be in there. That doesn't mean the public option's dead. What other than the public option is important to know about what's in this?
The big change in this bill is affordability. They added about $75 billion to the subsidies, making them a little bit more like the House subsidies, not quite as good, but near to it. They closed the Medicare prescription drug benefit donut hole. They make the excise tax start in 2018 for everybody rather than just for union members. They totally eliminate the Nebraska deal, but give all states a somewhat better deal on Medicaid. But these are, it should be very clear, not big changes. One problem for health care reform across this entire process is that we in the media, we report things that change day by day by day by day. And the things that change are the things that are controversial, the things that people don't like, the things that people are still trying to figure out. But the core of this bill, which are subsidies to tell people afford insurance, regulations to make it so insurers can't tell them no, a mandate so that the healthy people are going to buy insurance too, and then an exchange so they can buy insurance that they know is worth something. They have not changed. They're still there. They're still very, very good, certainly much better than what we have now. And it's just hard to get the press to report it day after day, but that is what it needs to refocus attention on, back onto the policy of the bill and off of the politics of Scott Brown's election.
And on that issue of the policy, as I mentioned, progressives, I think, sort of a mixed reaction today. The fact that the public option isn't there, because we've seen now, 20 or 21 senators sign on to a letter saying overtly that they would like the public option to be in anything that passes by reconciliation. That seems like there's been some momentum around that. The White House signaling as well that if the Senate wants that they would go ahead and fight for the public option again. On that issue that is so important to so many people and that continues to poll so well across the country, where are we at with the public option?
I think it took a really hard gut punch tonight. Right before I came here, news broke that Senator Jay Rockefeller, who'd been one of the key proponents of the public option in the Senate, said we should not do this through reconciliation. It's too big for that. It's too partisan for that. We shouldn't reopen this now. The White House and Reid have sort of been playing hot potato with the public option. Everybody's saying, if you can get this done, if you can wrangle the votes, if you do all the work, we'll sign on the dotted line. Neither one of them have been willing to do it because, frankly, they don't want to. And with Rockefeller coming out, he's sort of the first office to say, you know what, we support this, but we're just not going to do this now. And when he's moving back on it, that is probably, I would think, I would guess it's probably a lethal blow to the idea's momentum right now.
On the, in terms of the summit that's happening on Thursday, Ezra, what are you expecting other than Republicans to say, no, we're not going to give you any votes?
Pageantry. The summit is a bit of a weird bird because it is, in theory, a discussion between Republicans and Democrats. And I could imagine, Barack Obama saying, oh, tort reform, that actually is a good deal. If you would like to give us a couple of votes for it, we'd be happy to put it in the bill. But the real audience for the summit is not going to be present at the summit. It's conservative Democrats. What we have right now is a situation where we keep saying what Democrats should do. But we know what 95% of them are going to do, what they've already said they will do. It is is a small number, primarily in the House right now. We don't know exactly who they are, who's really in play, and we don't know exactly what they want because they've not been showboating the way some of the senators did in the run-up. But they are the ones who the White House is trying to get comfortable enough to come onto the bill. And that means showing that this is not a scary thing to their districts and it does not fulfill the worst fears of the Tea Partiers, and that they've made an effort to reach out. So it's going to be an interesting war of perception because we don't actually know what the relevant audience wants to see. And I don't think, frankly, that the White House or the Republicans do either.
Ezra Klein, staff writer for The Washington Post, thank you so much for your time tonight, Ezra. Really appreciate it.
Thank you.